Welcome to the launch of the Gender Justice Report during and beyond the COVID-19 crisis. And this report is specifically looking at how institutions and how we as legal empowerment organizations have responded to gender-based violence and continue to do so during this time. When we speak of gender-based violence in this context, we're making reference to domestic violence and intimate partner violence. So my name is Amy Ongeso, and I work for the Legal Empowerment Network convened by Namati. I am based in Nairobi, Kenya. I'll be your moderator for today. The Legal Empowerment Network is the largest community of grassroots justice defenders in the world. We bring together more than 2,400 civil society organizations and more than 10,000 individuals from 160 countries. So if you're joining us for the first time, you're in good company. Our goal is to cultivate a global movement for grassroots justice, one that is capable of collectively tackling the greatest justice challenges of our time. We work with legal empowerment organizations like yourselves to continue building this community. We also learn from each other, like today, to deepen our knowledge. And lastly, through advocacy, we work together to combine our voices to raise support for the legal empowerment field. If you have not yet joined us yet, please click on the link in the chat and join the Legal Empowerment Network. We'll be happy to have you. Please also use the chat to introduce yourself. You can say your name, organization, and country, because I don't think we'll have the time to go around. Now, today's launch is the first of a two-part series of events to be conducted in Sub-Saharan Africa. We have decided to bring you together from around the continent to engage on the findings of this study and to see if you resonate to the findings. It'll be great to hear from you as well, when you will be able to share your challenges in supporting women who face GBV during the pandemic, as well as the innovative solutions that you have employed to overcome these challenges. Now, in our second meeting, which will be held exactly 1 week from now, and hopefully all of you who are here will be there next week, we will be setting an advocacy agenda for the region. And hopefully as well, we will agree on collective next steps that we can take to influence our operating environment on the basis of this study. This study not only looked at how institutions responded to GBV, but also how we as legal empowerment organizations filled in the justice gap, reduced violence, improved service provision, and demanded accountability. Through this study, we're suggesting ways in which we can advance the physical and economic security of women and girls in emergency or a crisis setting. This great, wonderful publication is a result of a participatory research initiative organized jointly by the Legal Empowerment Network that is convened by Namati, TEMIS, which is a gender justice and human rights organization from Brazil. And the research was co-led and implemented by lead members of the Legal Empowerment Network. We're speaking of the Association for Emancipation, Solidarity, and Equality of Women from North Macedonia. We're talking about FIDA Uganda and the Bangladesh Legal Aid and Services Trust, BLAST, from Bangladesh. So moving on with today's agenda, Lynette from FIDA Uganda will give us a brief overview of the study and its findings. And then this will be followed by an interactive panel discussion with the 3 African organizations who participated in this study. We'll be hearing from Women's Safe House Sustenance Initiative from Nigeria, Lawyers Against Abuse in South Africa, and of course, from FIDA Uganda. Lynette, you're welcome.
Thank you so much, Amy. Share my screen. Yes, thank you very much for giving me the floor and this opportunity to just give a very brief overview of this study. So we did share the full report and a link to the full report in the course of this week. So everything, like the whole study is accessible to you, and you're welcome to read it for yourself. So this is just a very brief summary to start our conversation. Okay, so we are aware, and I mean this is not news for us, that the fact that the COVID pandemic broke out led to led to an incredible surge in gender-based violence across the world. This study really looks at what institutions, like what was the institutional response, what was the civil society response to this gender-based violence that we had experienced from start 2020 onwards. And we specifically focused on domestic partner violence and intimate partner violence. That was really the focus of the study. And what we did was to investigate the role of legal empowerment groups and in filling the justice gaps that was left in this time when the normal responses or the usual responses were no longer available, and how these groups stepped up and how they provided services and also demanded accountability in a very, very crucial time. So it was a participatory research initiative, and as I mentioned, it was led by the Legal Empowerment Network convened by Namati, along with Themis, based in Brazil, and co-led and implemented by the three organizations mentioned: SA in North Macedonia, FIDA Uganda, and BLAST in Bangladesh. So our methodology was it was a truly joint effort between Legal Empowerment Network and network members. It was 19 different organizations, grassroots organizations from Latin America, Africa, Asia, and Eastern Europe. And these organizations documented the experiences of frontline actors during the pandemic, and also analyzed these experiences to contribute to the findings. And in Africa, 5 different organizations participated, and from the southern, eastern, western, and central region of Africa, and all 5 organizations will be presented in the meeting today. So our approach was participatory. And what we mean by that was that the research participants really worked together in every phase of the study. And we worked together in designing the research questions, the structure of the research, and we documented these practices together. And then we compared experiences, and we're able to synthesize learning across all these very many different contexts. And the purpose of this was to produce the data and the insights that we produced, but also to facilitate peer learning and community building. And it was truly an enriching experience for those participating in the study to learn from others and learn new methodologies and ways of practice. The project focused on qualitative research methods. So we had a survey which our participants completed and about the effects of the pandemic on their work. And this was followed by in-depth interviews with each of them. We also had regional and global focus group discussions, case studies, and secondary research. From this, we developed 4 regional reports with comparative findings and lessons. And from these 4 reports, the global report, which aggregates and analyzes the regional reports, was developed. So in terms of the study findings, the GBV during the pandemic was at an absolute high. And we saw this in media, like reports from government, civil society, that this is a real crisis. And it led to the UN Secretary General to urge the international community to work together to end the shadow pandemic. And of course, we found exactly the same thing with our participating organizations, that they were also dealing with numbers of cases that they have not dealt with in the past. In terms of institutional responses, the study found that, the study confirmed really that the pandemic-related precautionary measures were really making it so difficult for women and girls to seek recourse when they face violence. And this was at the same time when there was an increased need for such institutional support. Most of the countries in our study, like in the from the 19 organizations in the different countries, had found that there were the measures of closure of courts, closure of shelters, and the enforcement of curfews, quarantine, and confinement. So the key institutional issues that we came across in the study were short staffing of police, because police were occupied really with enforcing the curfew, dealing with heightened levels of crime, different kinds of crime, and also reduced access to health institutions. There were also very few countries who actually took specific steps to address the needs of GBV victims during this pandemic. And you'll see in the report that Argentina really stands out as an exception. and in this regard, because they really had like this ideal model response of what your crisis response should look like, and taking into consideration the fact that women are going to face greater levels of GBV, and that your special measures need to be taken as soon as the crisis erupts to actually address that. So that's really the model that we look to, and that we hope that other countries will also adopt in future. Then we also looked at the role, and this is key to the study, to look at the role of the legal empowerment groups in this response, in how the legal empowerment groups responded to what institutions did and didn't do, and responded to the crisis of GBV, and used what was available to them, and to actually provide the services that were so direly needed in this time. And what we saw was that that even these legal empowerment groups themselves had to adapt their methods of working, because they were also facing the risk of the pandemic. And along with all of the support structures not being available to them, such as courts, police, bigger organizations, shelters, and they had to mitigate the risks they were facing themselves, and work in a completely new and different environment in a way, and yet come up with innovative solutions to really help women in need. The major challenges that we noted that were faced by these groups around the globe really was immobility, the digital divide, which excluded many of their groups from the new ways of doing things and the new ways of accessing services, as well as sustainability and funding. But even in the face of these many obstacles, the legal empowerment organizations were very creative in finding ways to serve their communities during the pandemic. And we found that this in large part was driven by the fact that many of our participants make use of the community paralegal model, as well as other community-driven approaches. These organizations already had trust within the communities where they work, and for people to, for communities to feel comfortable to come alongside them and face new challenges. The community paralegals had the freedom and had the trust to keep being involved in cases that might have escalated during this crisis, and that was really the starting point of successful legal empowerment work during this time. We will be discussing in more detail the challenges faced by these groups, as well as what was done, and as well as the approaches that was taken in our panel discussion and following this presentation. And finally, there were some important lessons and recommendations that were synthesized through this participatory work from across the globe. And I mean, we know that we are not likely to be free of the pandemic anytime soon. It would be a minimum of 2 years, but we don't really know for sure how long it will take, and before the cycle of lockdowns and waves of the disease will keep coming and going in different countries in the world. And in the meantime, it's so important for grassroots actors, for governments, for multilateral institutions, and for donors to make good decisions and to make sure that there's an effective GBV response in place in this time of crisis. We are hoping that that these recommendations can also be used and put in place to help us to prepare for any other kind of humanitarian crisis that would look different from the COVID pandemic, but that we would have this default response in place, so that GBV would not be at the bottom of the list when we face something similar in future. So a few of the recommendations that I will note. So this came through across the board, that there's need to designate access to justice as well as GBV services as essential. There's need for civil society who provide this kind of support to be able to continue their work even when there is a crisis, and therefore there's need for exceptions to be granted to such organizations. We also found that there was so much value in flexible and rapid funding being made available to these groups, and donors who were willing to adapt working methods, to adapt what funds are used for in order to really meet the most important needs. And we're really the ones who we saw had the biggest impact, and their groups could continue doing amazing and exceptional work because of having that support. We also recommend that it's important to encourage collaborations between civil society and government, and that this is especially so among community-level justice actors. So what we encourage is for community justice actors to work more closely with people in local government, as well as be engaging those at national level. Yeah. And also for the unique role of paralegals, community paralegals, in advancing gender justice and in combating GBV to be recognized and to be protected. Yeah, and in terms of this protection for frontline justice workers, this often looks like self-care, like putting things in place for these justice workers to actually protect themselves from COVID infection, from burnouts, and for actually be able to continue doing what they do on a sustainable basis. Another recommendation is to use technology appropriately, to find a balance in what we call the new normal, to not entirely switch over to an online method of working, but to make sure that we do not exclude the people that we work with, or the people who need to be able to, people who need to be able to benefit from different kinds of services by moving everything online. It's important to find that balance between online and offline working methods. Yeah, and finally, it's important to prepare state actors for future crises. For example, by establishing protocols to guide emergency situations ahead of time, so that we are better prepared for future crises. It's very, very important to address the digital divide, and to address the issue that so many, especially women, are left behind when it comes to technology. And finally, there's need to fund legal empowerment efforts sustainably. So that is the very, very brief overview of our global study. Thank you.
Thank you so much, Lynette, for that interesting and concise summary. I really like the point of flexible funding during this pandemic. It really gives legal empowerment organizations now to the ability to react responsibly to what is happening on the ground. And the question of inclusive approaches, everybody was going digital, forgetting about the digital divide. And with this point, I'm reminded of a case that is ongoing right now in Kenya, where one of the organizations in Nairobi, Kituo cha Sheria, have actually taken the judiciary to court for using this, digital approach, and they did not have public participation. So what that does is it makes accessing justice even more impossible for people who don't even have basic things like an email address or access to this kind of technology. So it'll be curious to see what the outcome of that case is. And lastly, the one thing that I've really appreciated during this time, if ever there's a time to appreciate community-based structures, was during the pandemic. The grassroots justice defenders, the community-based paralegals were in areas that we were unable to access because of the strict lockdown measures. So thank you for that. And I think this sets now the pace for our panel discussion. I take this opportunity to invite Rita Bile from Lawyers Against Abuse, based in South Africa, Wura from Women's Safe House Sustenance Initiative, based in Nigeria, and of course, Lynette, based in Uganda. You're welcome. Ladies, it would be nice if we had a round of introduction. We can start with Rita Bile.
Dumelang, hello everyone. My name is Rita Bile Mosese, and I am from Lawyers Against Abuse, or LVA, from Deep Sloot, South Africa.
Dumelang, and you're welcome. Wura.
Okay, hello everyone. My name is Wura Olua Ayodele, and I'm from Women's Safe House Sustenance Initiative in Nigeria.
Welcome, Wura. Lynette.
My name is Lynette Twelebua. I'm a program officer at FIDA Uganda.
Okay, with the introductions out of the way, we now go into some conceptual framing. We've made a lot of reference to legal empowerment organizations, what legal empowerment organizations were doing, their methodologies and their approaches. I'd like to ask Rita Bile, what does legal empowerment mean for you as an organization?
Well, Amy, we run a multidisciplinary team trying to provide an integrated approach to gender-based violence. As a law student, you often think justice is conviction at court, since joining LVA, I've realized that a lot more components are needed, right? And so we have our community engagement team. Mem Gansi is actually part of the discussions today. And what they do is conduct outreach and awareness in the community. They do talks at schools, they do talks at clinics, informing victims about their legal rights and available legal remedies. And so we found that the first step to just even accessing the law is knowing the law. So MEMGASI does the awareness, and what we found is that those people then come to the center and are able to access legal services. And then in a parallel process, our psychosocial team is available to provide counseling throughout the entire process. So thinking back to my training with Namati, it's knowing the law, using the law, and shaping the law, because we also need to change what doesn't work, right? So that, to me, in a nutshell, is legal empowerment.
Thank you for sharing that, Ritabile, and also for your experience. When you come straight from law school into the field and you're working with the community, it is indeed baptism by fire. I'd like to go to Wura. What does the organization describe legal empowerment as?
Okay, so for us, legal empowerment is ensuring that people, living in rural communities, which, by the way, are the communities that we focus on the most, understand what the law is and are able to use the law to defend themselves. We understand how critical it is, when you don't even know that you have rights that exist, and you can't even do anything to pursue or follow up on those rights. Now we're talking about people, in local communities who have limited education, have limited access to technology, people who don't even understand, what the law is or what the law is saying. So for us, legal empowerment is ensuring that we bring this knowledge to these people, make them understand, especially in line with gender-based violence, which is our focus, understand that these things you're facing first is wrong. These things are wrong. There are laws that protect you from these things. And you need to know the law first, to be able to defend yourselves. There's so many people that we meet every day who are facing GBV, but do not know that they're facing GBV because they feel it's part of their culture. It's something that goes on with religion. They grew up knowing that this is just something that happens. So for us, that's what legal empowerment is. Ensuring that people in local communities understand what the law is and how it defends them and protects them from violence.
Thanks, Wura. I'm seeing a common thread between you and Ritabile's approach in terms of educating people and letting them know what the law says. We live in a culture of normalizing where you think something wrong that is happening is okay because it has been normalized. So the knowledge of the law and this education challenges that. And using the law to have systems in place that can protect women or victims of GBV. Lastly, Lynette, what does FIDA think legal empowerment is?
Thanks, Amy. So for us, it's really it's really this whole process of how do you take this mystery and this intimidation out of the law and make the law the friend of the community? How do you let women and children who are vulnerable know that actually the law is there to protect them, to promote their rights, to serve their interests? And how we do this is through our work with community legal volunteers, which is our word for community paralegals. And these community paralegals, they are knowledgeable more than your average person about what the law means, what the limits of the laws are. And they are, they are really like the hands and feet in the communities, which they do the work of demystifying the law.
Okay, I think now we have like a good guiding framework that, we're focusing on the community, looking at how well they know the law, how accessible the law is to them, teaching them the law, and hopefully they are able to use the law to help their own, injustices or the challenges that they are facing. When we look at what has been happening during the pandemic, as Lynette was sharing with us, really the GBV cases, the numbers were astronomical. And we'd be happy for you to share with us the major challenges that your organization faced in terms of supporting women during this time. Rita Bile, what was it like? And what is it like right now? What are the challenges your organization is facing?
So in May last year, the president announced a hard lockdown. Everything shut, including our staff. We were locked at home, aware that abuse had intensified and the victims really needed support. No way to reach them. And so we tried first to have remote solutions, right? And so our social workers were trying to conduct counseling telephonically. It's not always possible in the context we work in Deep Sloot. Connectivity is an issue. There are power outages. Victims don't even have phones. Oftentimes the victim is in the same room with the perpetrator. So that was not sustainable. Government on TV, GBV is meant to be prioritized and fast-tracked. Difference again between the law on paper and lived reality. We found that there was in fact a limited functioning of the courts. So during this period, and even now to be sure, the time a victim needs to wait between an interim protection order and a final protection order is 4 months. In addition, with criminal cases, there were no trial hearings throughout 2020. And then critical government services were also not operating. So for example, statutory social workers charged with removing children in need of care were not operating. That means investigations were not conducted and children were then left with perpetrators. And we know in rape cases of minors especially, the perpetrator is usually somebody known to them. The government response was also very digital. And so we had the National Command Center that people were then meant to call in. Again, access to technology, a problem. It was a national response. And so in terms of language, for example, people who speak Afrikaans in Cape Town could not communicate. And in a context like Deep Sloot, which is a migrant community, English is not always necessarily first language either. And then also, in terms of geographic understanding, in Deep Sloot, there are areas that the police cannot enter just in terms of how it's structured. And so if you have someone from a national level advising on something so specific, it doesn't always translate. And so, yeah, 10,000 calls to the GBV Command Center within a short period of time, and the government deems GBV services as essential. We're then able to apply for permits and we're able to return to work. Now we have to think about PPE for staff. Fortunately, we had very responsive donors, and so we're able to reallocate some line items to ensure that the staff did have PPE available. Yeah. But Mem Gansi can speak to this in terms of our outreach. That was still a barrier because now we had restriction on the number of people for gatherings. And so having to think around how do we access people in this current context. I'll leave it there.
Thanks for sharing the challenges you faced, Retabile. And it's quite, when you read about it, but when somebody is telling it as you are right now, you even feel it more. Imagine being, in the same room with the perpetrator and you can't really access help. It really was a dire situation. Ura, was this the case for you in Nigeria? What were the challenges you faced?
Yes, it's amazing how, maybe I shouldn't say amazing anyway, how we face similar challenges, across the globe. So for us, I should say one of the first challenges was the fear of the pandemic. The fear kind of drove us into doing things that we ordinarily probably wouldn't have done, if we weren't just really afraid. And one of those things I would say was the fact that because as an organization, we run shelters for women, especially because we weren't sure who had COVID, who didn't have COVID, we had to shut down the shelters. The women in there couldn't come out. Those who wanted to leave, were free to go, but they couldn't come right back. We couldn't take in more women. We were very afraid of, everyone getting infected. And I want us to remember that last year, right now we have the vaccine, right? Last year we didn't have that. We didn't even know if there was ever going to be a vaccine, so we were just really being very, very careful. With the shelter shut down and the rise of cases for GBV, our hands were tied. There was really nothing we could do. And then there was also the lockdown in Nigeria. I would say it didn't last as long as it did in some other places, but it lasted for a while. And during this time, I would say that every other solution we could have explored suffered because of the lockdown. So hotels were locked down, guest houses were locked down. And usually, even before now, we'd always use hotels, guest houses, as alternatives when we didn't have a space to keep women, and we had more and more cases coming up every single time. We had limited people working in the organization. Everyone started to work remotely. And this is the kind of work that cannot exactly be done remotely, because people are calling you, women are calling you, and they need to see you. They need you to come and get them. It's difficult having a conversation on the phone and giving instructions on what a woman should do who is in distress, when all she really needs to do is, see you physically. And so that was a problem for us. Even though we had hotlines, our hotlines were busting every single moment. We were getting messages on social media, for responses. And unfortunately, we didn't have enough hands. We didn't have enough funding to, to meet up, with all those requests and all those responses, that we needed to do. The funding that we got, most times you have to do what the funder wants. And most funders at that time were only focusing on COVID and solutions for COVID, not necessarily, on GBV or solutions, for GBV during COVID. And this was a problem for us, because the kind of programs we were organizing, the kind of solutions we were bringing up were not exactly, for GBV. They were to help, protect women from COVID. The only time we were able to actually focus on GBV, with the funding that we got was, times when we say, okay, fine, GBV is also an effect, something from COVID. And so we're able to divert funds, to that. I would also say that the ability for us to support women in local communities, in rural communities, became really extremely difficult. This is because even before then, and this was before March last year, we didn't have community-based centers or spaces, where women could make reports. And so women who had to make reports would either look for somebody's phone, to call us with, or, it was more or less like word of mouth. You tell somebody to tell someone to tell us. And by the time we're getting to know about it, it's probably already too late. The courts were closed down, shut down. Should I also stretch the fact that even this year, the courts in Nigeria were on strike for about 2 months. And so, last year and this year, having that long stretch, and break in operation of the courts, affected our work and being as effective as possible to the women. I'll just say, well, these were the challenges we faced. We can go on and on about how many challenges we had, but I'll just stop there for now. Thank you.
Thank you for sharing that, Hura. And I really do agree with you. There's no replacing face-to-face interactions. And this is one thing we've learned to appreciate even more during this time. I see some similarities. When you say the fear of the pandemic, yeah, that was very real. We felt it even where we are. And the strict lockdown measures, after South Africa, South Africa's lockdown measures on the continent was like, on another level. And then we were also following the strict lockdown measures in Nigeria. And one thing we remarked is that, the government say everything is on a lockdown, but injustice is not on a lockdown. The quest for justice is not on a lockdown. So there are all these barriers that have been put for everything else, but injustice still goes on. And also that you highlight the donor inflexibility as one of the challenges. That was quite unfortunate. But I hope moving forward, these are lessons for our donors to take home. Lynette, Uganda in East Africa had one of the strictest lockdown measures. And what are the challenges that FIDA was facing during this time?
Thanks, Amy. The overall challenge is just the fact that the lockdown, the lockdown just didn't consider, it didn't consider gender. It just didn't consider it at all. There was this goal at hand, and it was just, and we did have a very, very strict lockdown for the first 7 weeks. And we're just through another equally strict lockdown recently. And what we find is that, like all the services that are really so essential for women to access justice were, they were just not considered. And we were often in situations where oh, and I should also mention that even before this lockdown, it's not that GBV has been a priority on Uganda's list of things to address. We don't have a single state-run shelter. That was the case even before the lockdown. So now you can imagine, after all these measures were taken, our hands were really tied in so many ways that, we have these cases and we know that women are in a, it's an impossible situation where you're in. Yet, where do you refer someone if there's no shelter, there's no court to hear the case? Police are so busy enforcing these lockdown measures and they're not available to help. Like we really needed to be very, very creative to not leave women that come to us in a situation, or that contact us in a situation that is absolutely terrible. And so yeah, so those were the main challenges. And I'd say also the fact that that there weren't exceptions, and the fact that you have this fear on you that even if you do have a very good reason to be to be disregarding the rules, even though if you have a very good reason to be traveling somewhere on a border because you have a medical emergency or a justice emergency, that you always run this, you always have this fear in you that if I am breaking the rules, I am risking my life. And it's a very unfortunate reality that we face, but that is the reality. If you are breaking the rules, you know that the person who is enforcing it can very easily go way too far. And even for that, there will not be justice, especially during a lockdown situation. And so I'd say that would broadly summarize the challenges that we face in such times.
Oh, all these challenges, yet as legal empowerment organizations, Lynette was saying that we had to creatively work around these challenges and still get to the people who really needed our support the most. So Wura, how has your organization adapted to continue to support women during this pandemic? I know you had mentioned that the safe houses were shut, limited functioning of the courts, the fear of the pandemic. How have you adapted? How is your work going on?
Okay, so thank you, Amy. For us, we were able to come up with something that we felt would work best, with the women. And this is what we call the community-based, GBV centers or boats, in local communities. And these were centers that were just in already existing spaces. So in shops, in pharmacies, in spaces that were open, despite the lockdown. And we looked at ways we could have these spaces, existing in local and rural communities, where women would just ordinarily walk into and make a report. And for us, we were still are working with these spaces, in collaboration with other CSOs, around us. And this has been extremely effective in locations, where women would always say, well, I don't know who to talk to about what's happening to me, or I don't know who to make a report to. I must mention the fact that a lot of women here will not go to the police if they're facing violence. They would only go to the police when it's extreme and they feel they have no other option. We've had women go to the police and the police would ask them questions like, oh, why are you here? Or it's a domestic issue. Let's try to see how we can settle it at home, So, but because the spaces now exist, women are able to go there, make a report, and then the host of this space, usually the owner of the shop or the owner of the pharmacy, is able to reach out to us and let us know, oh, we have a case at hand and then we need to handle this matter. We need to provide some intervention for this woman. And this has helped, especially for women who don't have access to the internet, cannot go online to share anything, do not even have phones, or are not allowed to go out without some form of monitoring from their perpetrators or their abusers. Some women are, for instance, only allowed to go to a salon to make their hair, and so we have centers and salons, where they can make reports and get a solution, of course. So for us, that's how we're able to adapt, because there was a lot of pressure we're spending more than we could afford to spend. There was a lot of pressure on everybody, the entire team. But with this and with, of course, our ability to collaborate, which is really important with other organizations, we're able to adapt, and try to see how we can make things work. As for the shelter has been reopened now, and of course, everyone who has to come into the shelter has to first take a COVID test. Usually the results out in less than 24 hours, and then we know, yes, you're able to come into the shelter. And so for us, that's how it's worked so far. And I'm hoping, well, it will work better as we move along. Thank you.
We can only hope as well, Wura. Thank you. Retabile, how's the situation in South Africa now? How are you coping and supporting women during this time?
So immediately after we were granted permits, our first thought was, okay, how do we let women know that the services are available, and how do we empower them to access the services? And so Bommem Kansie and the community engagement team worked with 22 volunteers. So these were people we had been working with in the community before. We'd had workshops around GBV, support services, legal remedies. And so it was just a refresher workshop. And then in addition, we had a workshop around COVID-19 symptoms, transmission, prevention measures. And then we had our door-to-door, broke into little groups, door-to-door over an 11-week period across all the extensions in Diepsloot. And in total, I think 11,500 community members were reached through the door-to-door campaign. But we found further specific vulnerabilities, right? And so for women who lack documentation, even though they reported an increase in both physical and sexual abuse, and that they were sometimes even starved, they were like, okay, apply for a protection order. Will I be deported? Will I be arrested? Other women told us, okay, I can apply for a protection order, but financial dependence, I have no way to go with my children. There are no shelters in South Africa, so I come access the service, and then what, Retabile? And then other women were like, no, it's an honest mistake. We will report if it should continue. And so understanding the cycle of violence and why it is that it is important to keep amplifying the messages. Bommem Kansie also reported during the door-to-door that they'd see women with fresh bruises, and women would just say, leave the flyer, I'll get back to you later. Other women reported that their phones and passports had been destroyed. But what is really heartwarming for me, because I didn't do the legwork, I just see the women who come to the center. And so you see people come and they tell you they heard about LVA from the door to door. Gaba, you see one of the volunteers who were themselves victims at some point accompany a client to seek a protection order. So that to me is heartwarming. And so that was just some of the strategies we used to ensure that there is knowledge, and then now continue with both the legal and psychosocial support services. And Amy, before you move on to the next person, I'd like to acknowledge Mem Gansi and the work she did through a very difficult time. It's easy for me to apply for a protection order. It's easy for me to apply for the donor funding, but she is on the ground day to day, forging the relationships, ensuring we have legitimacy. And so just wanting to publicly acknowledge her and the work that was done. Thank you.
Thank you so much. Thank you. I appreciate.
Thank you so much for the work that you're doing on the ground. It really gives us hope, even though it's a very difficult time and things seem to have become worse. But we're happy that there are foot soldiers like you giving us, the courage to go on and continue doing the work. Lynette, do you have anything to add?
Yes, thank you, Amy. So for Feed of Uganda, our main strategy was, during the lockdown times, to place much greater reliance on our community legal volunteers. The people, and I've mentioned this, they're already present in the communities. We already have relationships with them. They've already had some training, and they are present there. While we're not allowed to move from one place to the next, they're already present in their own communities. So the first thing that we did is we held an online refresher training for all of our CLVs to encourage and equip them for the period ahead. And we entrusted them with more than we did before, and they really stepped up for the challenge. Like we felt that our CLVs were really the stars of 2020 for the work that we were able to do, because they were on the ground, they were proactive, and they'd really taken on a more important role within our organization than what they were playing previously, and that has actually led us to to rethink the way that we work and to rethink our model, and ever since like mid 2020, we've been investing more and more of our resources into strengthening CLVs, into building networks among them, and into equipping like the groups that we work with legal knowledge and legal understanding, because we feel that this is just a much more sustainable and effective way of ensuring justice in a widespread manner. And something, other ways that we did is we did do like telemediations, that a CLV would be running a mediation in an area, and the lawyer would be calling in and giving advice. And like this was not usually for GBV cases, but for different kinds of cases, it was an effective way of working, and working on the phone, like giving advice and guidance on the phone, and even to clients, like for online methods and for apps and for apps and WhatsApp. And then another important aspect in our response has been working with community justice actors, and leveraging on the relationships that we've built with district leaders, with police, with partner organizations over many years. And because we've had a presence in districts for a very long time, we were able to join district task forces, and we were able to have an input on the decisions that were made at district level. And eventually we were also able to get permits to drive around in the districts. And what we found is now with the second lockdown, because these things have already been put in place, and these measures have already been practiced, and it wasn't difficult or confusing, or it was a very quick process for us to just apply for and get the permits in the districts that we work, because all those relationships are already there. And we're also grateful to the police in many of the districts where we work. Like, they are really our allies. We like when they have an opportunity to speak on the radio, they will invite us, and we can advertise our services, and they will allow us to make use of their cars when in times when we're not allowed to drive. And when we go with them to do community outreach, or to reach communities, we know that we are protected and we won't get arrested. And so it's really been working with community legal volunteers as well as community justice actors.
Thanks for that, Lynette. In this, what people say, unprecedented times, you come across unlikely allies such as the police, who really gave you the support you needed to be able to do your work. And also this term, working on the ground, it stopped being abstract during this time. When Retabile was talking about going door to door, you were literally on the ground, moving from door to door, trying to get people who need help the most, and seeing for yourself, that this is what these people are going through the bruises that Retabile was speaking about. So now, thank you so much to the panelists for being very honest and having, deep reflections about the challenges and how they've been able to creatively support the victims of abuse that they work with. I'd now like to invite our participants. Lynette shared the report, and I'm curious to know, do the findings resonate with you? Does this report reflect the realities that you're going through? It's an open floor, you can just raise your hand. Maybe I can ask the question again. From the report and the findings we've shared, do they resonate with your reality? Is it something that you can say, this report really reflects what has been happening on the ground for us? Amina Hanga, might you have something to contribute?
Hi, Amy.
Hi, Amina.
Hi. Sorry, I got distracted a bit and missed the question. Can you repeat it again?
Yes, Amina. So we've had from Lynette sharing the findings of the report. Would you say that the findings resonate with your reality in Kano, what you've been facing on the ground during this time as regards GBV?
Yeah, it is. I think it's from the summary that Lynette gave and what others have said. It was basically the same sort of issues. For us, also being able to reach community-based paralegals because we work in the rural communities. So access to them was really difficult. One, because of network issues, and so getting a hold of them, and also because of electricity problems. So a lot of times you couldn't get through, and then they say there was no electricity, so they couldn't charge up their phones. Sorry, they're drilling a borehole in in the compound next door, so the noise is really coming through. So that was that was some of the challenges that we faced, and then network issues as well. So even when we wanted to even through um, using the internet, WhatsApp or something, that also was very difficult. I know for the paralegals, it became a matter of what was more important, loading up my phone or buying food for my family with the little resources that I now had, that was no longer available. It was a really distressing time for a lot of them. And there was that fear because, like Ura Olua said, um, in the for us in Kano, people didn't really believe in COVID. So you would find, like, I know a paralegal said that, they were really worried about, scared to get the COVID. The fear was there because people may come with problems, but they were not willing to mask up or take precautions. So they had that challenge of wanting to provide services and being very careful that they would catch COVID. As in the rural communities, they just didn't believe it was a problem. They just felt it was a disease for the rich people, as it was happening mostly in Lagos and Abuja. And of course, a lot of it was because of flights and stuff. So they said this is a disease that was affecting the rich people and not the poor. So there was that. And then when we were having a lot of deaths that were happening at one time, which we for all believe was COVID, but because when you die, especially using the Islamic, many people, once you die, they don't go to hospital to get it verified. So maybe there they would have found out that was COVID. They would just bury. So the cemeteries were like really full, and it's just somebody dying of, people dying of, but without really knowing why. But people really felt that it was COVID at that time, though the government denied it and said no. It still continues to be a challenge for us because um, for a paralegal, people, as poverty has increased, it continues to increase. People recovering is still, it's really taking a long time. For some, even for our paralegals, we've had some of our male paralegals having to move far afield now in search of um, livelihood, looking for life income, seeking work away from now their communities, even leaving the state in search of work. So it has impacted on our work, and it means that we are also looking at how we can train up other paralegals so that they can replace those that have left. But for those that stayed, they're still working very hard, but it's just managing resources and to the best of our ability. And it also means that because of this COVID, it has increased insecurity in the country, especially for us here in the north. We have more cases of banditry and kidnappings going on. So for our paralegals to, especially our female paralegals that would go to hard to reach communities, they're being very careful now because you just don't know when an attack could happen or when you can get kidnapped or what. So that has created a lot of insecurity for all of us. We have to be more careful and more vigilant in terms of when going out into very remote communities.
Thank you so much for sharing, Amina, what is happening in Kano, which is, I think, north of Nigeria. Um, Taita, I hope I'm pronouncing it well, Taita Mukamsi. You got a shout out from Retabile for the work that you're doing on the ground, the door-to-door, going to reach out to women during this time, during this pandemic crisis. Do you want to share with us a bit of your experience and yeah, a bit of what you've seen on the ground and the support that you're trying to give as well? Taita Mukamsi? Or maybe she'll join us later. Anybody else with some experience to share? Oh, okay. Oh,
Yeah,
okay.
I've got a problem of network because you were cutting, so I will not hear you well.
So do you want me to repeat the question?
Please.
Yes. So we're saying that you got a big shout out from Retabile, a big appreciation for the efforts that you're doing on the ground to reach out to, the women who are really suffering during this time. Would you like to share a bit of your experience with us?
Thank you so much for being given this opportunity. As Lawyers Against Abuse in June 2020, we realized that we were experiencing challenges in order to reach our clients. In order for us to receive new clients, it was a challenge. Again, when we opened early, that made a lot of people who are hungry being going around. So we were receiving most of clients who want food parcels that assisted us to share about our work. But we could not find those who are in GBV challenges. So from the June, we decided that we need to visit the community. We need to better go door to door. Then that we realize that we need someone who will go and present it the way we as LVA want to present. So then that's where we now work with our previous groups. We have a community policing forum and the community action group that we've been working with previous years. So we started by having a mini workshop in order for us to speak one language, to discuss more about doing door-to-door. So yes, we had a great time. We were targeting one extension per week. Then we planned to do it 2 days a week, which was Tuesday and Thursday. Then targeting all 13 extensions. So yes, the challenge was people were under lockdown, and then it was cold, and it was hard for people to go out. So some days would be not easy because there would be wind and so cold, and people will not be coming out. Some days will be easier because there will be people on the street. When they see us wearing t-shirts, they will really want to know what is going on, what are we doing? Is it food parcels? What is it? So it also helped us. I remember one day we were experiencing challenges because it was cold and people were not around. We decided to park on the busy street, and then I parked my car there. So all of us were wearing t-shirts. We were 15 that day. So yes, everyone just wanted to know what is going on. So that helped us for a lot of people to just come. But only that day we managed to see more than 900 people. So yes, being in the community, I really appreciate hearing messages from the community, to say such services, they are so important. They were referring clients. They were also having a lot of questions around legal matters. Some, yes, they needed food because whether they are hungry. Some, when we arrive, we find that they're fresh dress, like they could not talk. You will see by sign to say that, like, just cast, you don't continue with whatever that you're doing. So we had a great time because with the team, again, we saw that it is very important that we debrief after, thinking of the shock of the messages that they will be receiving in the community. Yes, so we had a great time in the community. We have learned a lot in the community that, our services are needed. We also realized that some people just started to hear about us. And we also realized that there are some extensions that totally do not have services where our services can be really benefiting to them. So yes, we spend a lot of time in the community and really having a lot of time to answer because of lockdown, people were not having people to share things with. So now we have to realize that we need to send messages, and also we need to listen to the community when they're discussing. Some of the discussion were not about legal matter that people need assistance. We were able to refer to different places. And the challenges now was that we opened early, and we're now experiencing that, in some cases need to go to SAPS, South African Police Services. When they go there, someone tested positive and then they closed. So when you go to court, you receive a message in the group that the court is closed. They can't be able to assist them. So it was really on and off, because now when we need to send people to get assistance on things that LVA cannot be able to assist, like protection order at court, now it became a challenge. But sending message to them and also letting them know that as LVA we are open, we are ready to assist. It was a great thing to the community, and we saw them coming. We saw them coming with open protection orders. We saw them coming, coming for counseling. Some were being referred. They said because we gave them pamphlets, someone gave them pamphlet and then decided to come. I felt as a great news, and I'm really grateful of the team. Because we had the t-shirts. It was not only for the 3 months that we did from June to August. It was also again for the community. When they were wearing t-shirts, they were having questions after to understand what is going on, what was going on that day. Then some were having questions. Then they will send WhatsApp and ask, this person is asking this, how do we do this? So yeah, I really enjoyed the time we spent in the community. It was a great learning. And also I like the way they were like also advising us to say, you need to do this more often, because this is a transit community where others, they don't even know that lawyers against abusers here. Today you will say this person is staying here, tomorrow they are gone, they are new people. So the more we do it, the more we can be able to approach the whole community. Thank you so much.
Thank you so much, Taita, for those lessons from the ground. And it's also quite uplifting that you enjoyed doing what you're doing despite, the tough conditions, the weather, people contracting COVID, maybe some were not very reluctant to listen to the messages, but you kept going on. Thank you. I see Chelsea Hero, I think from Sierra Leone. Might you have something to share with us? Okay, as Chelsea is probably working on her connection issues, I have just one more round of anyone who would like to share about what the organization has been doing this time to support the victims of GBV and some of the challenges that they've been facing. Just one more round.
Good afternoon. Hi, Amy. This is Annette.
Hi, Annette.
Yeah. So sorry, I got in a bit late into the call, but I managed to read the report, and just to say that a lot of what the findings of the study are very reflective of what has been happening in our country, in Kenya. So I work in Kituo cha Sheria based in Nairobi, but we have programs that are nationwide. And I think one of the things that we have definitely saw, as the report also alluded to, is that there was an increase in the number of GBV cases. We saw this increase through our mHaki platform. That's an SMS platform where members of the public can then send queries, legal queries, and they would receive response. So the platform marked increase in the number of GBV cases. Also, we similarly, our paralegals, our community paralegals, also had an increase in the cases that they received. So in terms of the response that we took, is first we kind of sensitized our community paralegals a bit more on gender-based violence. Gender-based violence is one of the areas that we do train our community paralegals on, but during the COVID pandemic, we felt that we may need to kind of give them some refresher training on that area. So we had some areas where we actually just trained them specifically on gender-based violence and what kind of response they could give in such cases. The training was very useful because then a lot of them would be able to know who to approach or how to treat survivors of GBV, as well as how to approach the court when it comes to cases moving to court. The other thing that we did was to increase our public sensitization. And this we did through radio talk shows. During that time, obviously, we could not have physical fora or physical interaction with communities. So we resorted more to radio as a means or a medium for our public sensitization around gender-based violence. And the radio talk shows were actually done by the community paralegals. So because the talk shows were mainly focused on community radio, sorry, they were held in community radio stations, then hearing from another community member was more, they could associate or they could relate more to what information they were being given in terms of GBV, the gender bias and stereotypes, and also how to respond to some of those cases. So we felt that then there was a need to also still in our other trainings with the community paralegals that we had later on is to have a much longer session on gender as well as on gender-based violence. So when we did hold trainings for our community paralegals, especially the new ones that we established in the course of this year, then we did have a very strong component on gender-based violence. And we've had also a lot of collaboration with other civil society organizations that work specifically on, on women's rights issues. So for instance, we've collaborated with FIDA. We've had conversations as well with the Gender Violence Recovery Center. And I think this kind of collaboration and conversation is really useful because one of the gaps in terms of response has been the lack of coordination amongst stakeholders who are involved in GBV response. So I think just having some more interagency kind of collaboration within civil society space, but also within government is very helpful. And this is something that even the government of Kenya as well has adopted and intends to adopt this approach moving forward when it comes to GBV response. So a lot still needs to be done. And I think we have seen that this particular, because Kenya saw a real huge increase in teenage pregnancies, the highest in East Africa, as well as gender-based violence cases within the country. There was an increase of 92% last year. So the government now is more focused on this and is putting in a bit more money for gender-based violence response. And we are seeing some more positive action from the state. And we expect that this should go on within this year and even the forthcoming years. So I think for me, that would be what I would share in terms of our response. Back to you, Amy.
Thank you so much for sharing those statistics, Annette, and what Kituo Cha Sheria has been doing to adapt to the situation and be more responsive to the needs of the people we work with, the communities that we're in, and the communities that we serve. This has been a very interesting panel discussion, right from the report findings that Lynette shared with us to the panel. Yes, sorry, I hear Chelsea.
Hi, please.
Please go ahead, Chelsea.
I had a very bad voice. I have cold. I just can't talk. I'm lying on my bed. You know, I have you call me just now. The line was bad. Trying to pick it up, but I had a very bad voice now. I'm struggling with cold. I don't know if you even getting me there.
I've gotten you so far, and I offer you my apologies and a quick recovery to you, Chelsea. But thank you for making it to the meeting, even on your bed. We really value your participation here. Thank you, Chelsea.
Okay.
So this has been quite interesting for us, and even listening to the panel discussions from the various experiences in Nigeria, in Uganda, in South Africa, and what Annette has shared right now, bringing it home here in Kenya. I mean, the statistics are quite high. There's still a lot of work that we need to do, but I think we're on the right track in terms of, documenting what we've been able to do, having a discussion on it, saying that really this reflects our realities, and so what are the next steps? It has been a pleasure moderating this session, and now I hand it over to Martha to give us the closing remarks.
Hi, Amy. I think Luciana will be giving the closing remarks, but it's a pleasure to be here and have listened to everything that you have been sharing and see how it resonates with the report. So I appreciate. We can't hear you, Luciana.
You're on mute, Luciana.
Now, yes? Perfect. Thank you. I just say that thank you very much, and I think that we can have a closing remark together. We told the team that participate in this report with Lynette, Amy, Martha, and Abby is also here. This is not closing remarks because we have another call next week. So we are. This is just the beginning for us, and for me it was really a pleasure to hear all your experiences during this more than an hour. And hearing all the commonalities that even in the different contexts the organization has. So we are also having similar conversations at this one in other regions, in Eastern Europe, in South Asia, and in Latin America. And even with a lot of differences in the context. This is something that we identify in the report, but this is something that we want to explore more in the future, is all the commonalities and hearing all the experiences and how your organization adapted during the pandemic, and how the organizations can cover and fill a big gap on justice for women during the pandemic. I think that there is something very powerful here, and something that we need to address together, to learn each other, and to identify what we can do together. So the idea of these conversations is to have a very informal conversation. So for that reason, this is not a public launch of a report. It's a conversations with organizations that are working on the ground, with communities, with a lot of challenge that day to day. And our role and what we want to do is work together to support each other, to identify what we can do together in the future. For us, this report, for us in the network, was the beginning of what we want to have as a collective path at global level, but also in the different regions that the network is working. Identifying what's the role of community paralegals and legal empowerment and grassroots justice defenders can have not only on GBV, but in general on different gender injustices. And hearing not only the commonalities, but hearing all the experiences on the activities and what you were able to do during the pandemic. This is not something that started in the pandemic. This is something that you could do because you have years and years of working directly with the communities day to day. So the communities already trust on your organization. So so all these activities on WhatsApp, door to door, the different online platform, having the phone of different people and clients. So this is something that didn't start with the pandemic, and this is something that a lot of institutions can learn about, is that in the pandemic, you cannot start, oh, now we have to do something because we have a problem. Is that you need to build before the situation is there. And something that legal empowerment and organizations show during the pandemic is that all this work that they've been doing during the times before the pandemic was crucial to support women and girls in situation of violence. So this is not as I say, this is not a closed remark. This is an invitation to participate in the next conversation that is coming next week. And if you have time between now and the next call to think about what do you think we all can do together. We are building a common platform on organizations working on legal empowerment and gender injustices. We think that there is a lot that organizations can learn each other, and a lot collective learning that we can build. And also on the advocacy side, on the discussions around justice and the reforms and the justice system need, in general, the voice of organizations that go directly with the communities at grassroots level is not enough represented. So there is a lot we can do together, and the idea. So Amy, you are going to talk now about the call that we have next week. But if you have time between now and next week to think about that, and after hearing all the other organizations' experiences, what we can learn from each other, what kind of collective learning we can build, what we can do on advocacy at regional, global, and national level together. I'm sure that you all are part of networks and coalitions working on gender justice. But here, what I hear in this conversation is there is something very specific on organizations that work directly with the communities to address gender injustices, and something that we can work together in the future. So this is an invitation. So this is not a closed remark. This is an invitation for the next call coming next week. And I'm very happy to be here hearing all your experiences.
Thank you so much, Luciana. Lynette?
Yeah, and thank you so much for everyone who who've really taken an interest in this work. And I'm also speaking to our colleagues all across the continent, and because we were 5 organizations who were research participants in this study, and it was wonderful to have these like initiatives or like these ideas coming from Cameroon, coming from Nigeria, coming from South Africa. So we are grateful for this, this opportunity to collaborate and to work together as organizations from different countries across the continent. And we really hope to take this into a next step, and to have more more that we do collectively. So please do join us for next week's meeting.
Thank you, Lynette. I really, really feel like the stereotypic person who says last but not least, and then last again, and I'm still going on. But this is last for real. We will have a summary of this conversation, and we will share it with you via email so you can have a look at it. And hopefully you'll be able to join us again for this same meeting next week as we look to set the advocacy agenda based on the findings of this report. Thank you all so much. Have a wonderful morning, evening, or afternoon, and we will definitely be in touch. Bye.